In this segment, we're going to show you how to do a muscle energy technique for a left-on-left sacral torsion. So a torsion with sacrum rotating to the left around the left axis. In this case, it's the axis that determines the position of the student, or the patient. So we're going to ask our patient, since it's a left-on-left axis, patient lies on the left side. But it's not a lateral recumbent position, it's a modified Sims position. So we're going to ask our patient to slowly lie down as if he was going to lie on his side, but turn his left arm out and hug the table as he goes down. So his lumbar spine is kind of lateral recumbent, but his chest hugs the table. And one of the ways you can remember this is that this left-on-left is a forward torsion. It's a sacrum rotating forward around the axis. And therefore, since it's a forward torsion, he lies and hugs the table on his front of his chest. So it's forward. Then I'm going to sit down next to the patient, come in on this little stool here, and we're going to try to palpate his posterior iliac spine on the right. We're going to bring his knees up and flex him up till we kind of engage the sacroiliac joint. And I let my thigh here rest his legs. Sometimes you need to put a pillow under the patient's thigh because we're going to be dropping the feet down and the leg and the lateral thigh can get caught on the edge of the table. By putting your thigh there, you can sort of stop some of that thigh pressure, or you can use the pillow. Some people like to sit facing down, some people like to sit this way. I just like to sit looking straight at the patient. Since it's a left-on-left, a forward torsion, you can remember left on left. There's two L's. So therefore, keep both legs together and just drop them off the table until you find that movement come up to here. And now I simply just hook the PSIS and ask the patient to just gently lift both ankles towards the ceiling. By lifting both ankles, what I'm getting is a post-isometric relaxation effect on one side, a reciprocal inhibitory effect on one side, and maybe a little tug on the sacrum to pull it in the direction it needs. And relax. You can do that 3 to 5 seconds. As he relaxes, see if the legs go down a little bit more. Ask to push the patient up again towards the ceiling with both legs. The doctor resists with a downward pressure towards the floor. And relax. He relaxes and just sort of go with the relaxation. And now try that one more time. And you can do this for 3 to 5 seconds, like typical muscle energy. And you may repeat it up to 5 times in this area. And relax. And take them down. And then you would just control the patient's lower legs, bring them up off the table a little bit, and then bring the patient back down to a prone position, where then you can reassess your somatic dysfunction using the parameters of diagnosis you used to initially make the diagnosis in the first place.